Well, the system's broken, and I think that people all across the country recognize that. Certainly I don't accept the idea that in the richest country on earth we should have 47 million people without health insurance and millions more people who are being bankrupt because of a medical bill. And I know something about this personally. My mother died of ovarian cancer when she was 53. In the waning months of her life, she was not spending all her time thinking about how to get well or even how to come to terms with her own mortality. She was spending time thinking about whether or not the insurance company was going to cover her expenses because she had gotten sick right before taking a new job and it wasn't clear whether this was going to be considered a pre-existing condition. And that's wrong. There's something fundamentally wrong about that. And that's why, as President of the United States, what I've proposed to do is to make sure that we've got a plan that covers all Americans.
The very first promise I made on this campaign was that as president, I will sign a universal health care plan into law by the end of my first term in office.
The key to making this happen is going to be to overcome the resistance that we're going to see from drug companies, insurance companies, HMOs. Over the last 10 years alone, the drug and insurance companies spent $1 billion in preventing health care reform from happening. That's going to require then a mobilization of energy among the American people to insist on a Congress and a White House that are actually going to deliver this time. And it also means somebody who's going to have the capacity to bring people together across various divides, getting business, getting labor, getting doctors and nurses, consumers to join together to craft this kind of new legislation. I think it's going to be difficult, but I think it's going to be possible, and the time is right because nobody is satisfied with the system as it's currently working.
My plan begins by covering every American. If you already have health insurance, the only thing that will change for you under this plan is the amount of money you will spend on premiums. That will be less than what you're spending now. But if you're one of the 45 million Americans who don't have health insurance, you will have health insurance that's available to you. No one will be turned away because of a pre-existing condition or illness. Everyone will be able to buy into a new health insurance plan that's similar to the one that every federal employee, from a postal worker in Iowa to a congressman in Washington, currently has for themselves. It will cover all essential medical services, including preventative, maternity, disease management, and mental health care. And it will also include high standards for quality and efficiency. If you can't afford this insurance, you'll receive a subsidy to pay for it. If you change jobs, your insurance will go with you. If you need to see a doctor, you will not have to wait in long lines for one. If you want more choices, you will also have the option of purchasing a number of affordable private plans that have similar benefits and standards for quality and efficiency.
From soup to nuts, we've got to reform this system. We spend $2 trillion on health care every single year. We spend twice as much per capita as the next nearest country.
The second part of my health care plan includes 5 long overdue steps we will take to bring down costs and bring our health care system into the 21st century. First, we will reduce costs for businesses and their workers by picking up the tab for some of the most expensive illnesses and conditions. Second, we will finally begin focusing our health care system on preventing costly, debilitating conditions in the first place. Third, we will reduce the cost of our health care by improving the quality of our care. Fourth, we will reduce waste and inefficiency by moving from a 20th century health care industry based on pen and paper to a 21st century industry based on the latest information technology. Almost every other industry in the world has saved billions on administrative costs by computerizing all their records and information. Finally, we will break the stranglehold that a few big drug and insurance companies have on the healthcare market. We all value the medical cures and innovations that the pharmaceutical industry has developed over the years, but it's become clear that some of these companies are dramatically overcharging Americans for what they offer. They sell the exact same drugs here in America for double the price of what they charge in Europe and Canada. They'll push expensive products on doctors by showering them with gifts, spend more to market and advertise their drugs than to research and develop them, And when a generic drug maker comes along and wants to sell the same product for cheaper, the brand name manufacturers will actually pay off the generic ones so they can preserve their monopolies and keep charging the rest of us higher prices. And we just don't have to stand for that anymore.
We're not going to get change unless we can overcome the resistance of the drug companies and the insurance companies, the HMOs, those who are making a major profit from the system currently. Now, I think that all those industries have a role to play. We're not going to transform the system overnight. And we want to listen to what they have to say. They should have a seat at the table, but they can't buy every chair. And they can't dominate the conversation. They're just one aspect of it. Those who should dominate the conversation are American families who want to be well and want to make sure that their children are cared for. Now, obviously, I think my plan is the best one. But, there are going to be a lot of good plans out here. Other candidates are going to present plans. And that's what we've seen every 4 years, people trotting out their health care plans, and then nothing happens. And understandably, I think the public gets cynical. The problem is not going to be whether you've got the perfect 10-point plan. The question is whether or not we can overcome the broken politics in Washington that prevents a conversation to actually get this done. My commitment is to listen to everybody and to not have pride of authorship, but just to move a process forward, knowing that our goal is we should have everybody covered, the system should be cost effective, we shouldn't be discriminating on the basis of pre-existing conditions, everybody should have a right to care, that we should make sure that families who already have health insurance are getting some relief in terms of the payments that they're making. And if we have those goals in mind, there's no reason why we shouldn't be able to all move forward to make sure that we finally take care of this problem that has hurt American families and hurt the American economy for too long.